Welcome. Today we will learn about Diovan medicine. Diovan 80 Valsartan tablets are used for the treatment of hypertension. The medicine is used only as directed by a registered medical practitioner. It is an angiotensin II receptor blocker, ARB. It relaxes blood vessels by blocking a hormone, angiotensin II, that normally causes them to tighten. This makes it easier for the heart to pump blood. Package contains. Each package of Diovan 80 contains 28 tablets of 80 mg and in enclosed informational leaflet. It is also available in 40 mg, 160 mg and 320 mg. Strengths. Composition. Each film-coated tablet contains Valsartan, Novartis Specs, 80 mg. MFG. Novartis Specs. Indications. Uses. It is indicated for hypertension, treatment of hypertension, heart failure, treatment of heart failure, NYHA class WIV, in adult patients receiving standard therapy such as diuretics, digitalis and either angiotensin converting enzyme, ACE, inhibitors or beta blockers but not both. Presence of all these standard therapies is not mandatory. Diovan improves morbidity in these patients, primarily via reduction in hospitalization for heart failure. It also slows the progression of heart failure, improves NYHA functional class, ejection fraction, and signs and symptoms of heart failure and improves quality of life versus placebo. Post-myocardial infarction. Diovan is indicated to improve survival following myocardial infarction in clinically stable adult patients with signs, symptoms or radiological evidence of left ventricular failure and/or with left ventricular systolic dysfunction. Dosage regimen and administration. It can be given with or without food and should be administered with water. 4. Adult population. Hypertension. The recommended dose of Diovan is 80 mg film-coated tablet once daily, irrespective of race, age, of gender. The antihypertensive effect is substantially present within 2 weeks, and maximal effects are seen after 4 weeks. It may also be administered with or without antihypertensive agents. Heart failure. The recommended starting dose of Diovan is 40 mg, film-coated tablet twice daily. Up titration to 80 mg and 160 mg twice daily should be done to the highest dose tolerated by the patient. The maximum daily dose administered in clinical trials is 320 mg in divided doses. Evaluation of patients with heart failure should always include assessment of renal function. Post-myocardial infarction. Therapy may be initiated as early as 12 hours after a myocardial infarction. After an initial dose of 20 mg twice daily, Valsartan therapy should be titrated to 40 mg, 80 mg, and 160 mg film-coated tablets twice daily over the next few weeks. The starting dose is provided by the 40 mg divisible tablet. The target maximum dose is 160 mg twice daily. In general, it is recommended that patients achieve a dose level of 80 mg twice daily by 2 weeks after treatment initiation and that the target maximum dose be achieved by 3 months. Based on the patient's tolerability to Valsartan during titration, if symptomatic hypertension or renal dysfunction occurs, consideration should be given to a dosage reduction. Valsartan may be used in patients treated with other post-myocardial infarction therapies, e.g. thrombolytic, acetylsalicylic acid, beta blockers, or statins. Evaluation of post-myocardial infarction patients should always include assessment of renal function. Note: for all indications, no dosage adjustment is required for patients with renal impairment or for patients with hepatic impairment of non-biliary origin and without cholestasis. Use in children and adolescents. The safety and efficacy of Diovan have not been established in children and adolescents below the age of 18 years. Contraindications. Known hypersensitivity to Valsartan or any of the excipients of Diovan. Concomitant use of angiotensin receptor antagonists, ARBs, including Diovan or angiotensin converting enzyme inhibitors, ACELs, with aliskiren in patients with type 2 diabetes. Warnings and precautions. Patients with the following conditions should use it with caution. Patients with sodium and/or volume depletion, renal artery stenosis, impaired renal function, hepatic impairment, and angioedema. For detailed information, read the leaflet or ask your doctor, pharmacist. Adverse drug reactions. Adverse reactions are ranked by frequency. Within each frequency grouping, adverse reactions are ranked in order of decreasing seriousness. Hypertension. Adverse drug reactions in hypertension, blood and lymphatic system disorders, not known, hemoglobin decreased, hematocrit decreased, neutropenia, and thrombocytopenia. Immune system disorders, not known, hypersensitivity, including serum sickness, metabolism and nutrition disorders, not known, blood potassium increased. Ear and labyrinth system disorders, uncommon, vertigo, vascular disorders, not known, vasculitis, respiratory, thoracic, and mediastinal disorders, uncommon, cough, gastrointestinal disorders, uncommon, abdominal pain, hepatobiliary disorders, not known, liver function test abnormal, including blood bilirubin increase, skin and subcutaneous tissue disorders, not known, angioedema, dermatitis bullous, rash, pruritus, musculoskeletal and connective tissue disorders, not known, myalgia, renal and urinary disorders, not known, renal failure and impairment, blood creatinine increased, general disorders and administration site conditions, uncommon, fatigue. The following events have also been observed during clinical trials in hypertensive patients irrespective of their causal association with the study drug: arthralgia, asthenia, back pain, diarrhea, dizziness, headache, insomnia, libido decrease, nausea, edema, pharyngitis, rhinitis, sinusitis, upper respiratory tract infection, viral infections. Adverse reactions in heart failure and/or post-myocardial infarction, blood and lymphatic system disorders, not known, thrombocytopenia. Immune system disorders, not known, hypersensitivity, including serum sickness. Metabolism and nutrition disorders, uncommon, hyperkalemia. Nervous system disorders, common, dizziness, postural dizziness, uncommon, syncope, headache. Ear and labyrinth system disorders, uncommon, vertigo. Cardiac disorders, uncommon, cardiac failure. Vascular disorders, common, hypertension, orthostatic hypertension, not known, vasculitis. Respiratory, thoracic, and mediastinal disorders, uncommon, cough. Gastrointestinal disorders, uncommon, nausea, diarrhea. Hepatobiliary disorders, not known, liver function test abnormal. Skin and subcutaneous tissue disorders, uncommon, angioedema, not known, dermatitis bullous, rash, pruritus. Musculoskeletal and connective tissue disorders, not known, myalgia. Renal and urinary disorders, common, renal failure and impairment, uncommon, acute renal failure, blood creatinine increased, not known, blood urea increased, general disorders and administration site conditions, uncommon, asthenia, fatigue, blood potassium increased, frequency unknown, reported in post-market reporting. The following events have also been observed during clinical trials in patients with heart failure and/or post-myocardial infarction, irrespective of their causal association with the study drug: arthralgia, abdominal pain, back pain, insomnia, libido decrease, neutropenia, edema, pharyngitis, rhinitis, sinusitis, upper respiratory tract infection, and viral infections. Interactions: dual blockade of the renin-angiotensin system, RAS, with ARBs, ACEIs, or aliskiren, potassium, non-steroidal anti-inflammatory agents, NSAIDs, including selective cyclooxygenase 2 inhibitors, COX2 inhibitors, lithium transporters. For detailed information, read the leaflet or ask your doctor, pharmacist. Pregnancy, lactation, females and males of reproductive potential, pregnancy, risk summary. As for any drug that acts directly on the RAAS, Diovan must not be used during pregnancy. Due to the mechanism of action of two antagonists, a risk for the fetus cannot be excluded. In utero exposure to ACE inhibitors, a specific class of drugs acting on the RAS, during the second and third trimesters has been reported to cause injury and death to the developing fetus. In addition, in retrospective data, first trimester use of ACE inhibitors has been associated with a potential risk of birth defects. There have been reports of spontaneous abortion, oligohydramnios, and any renal dysfunction when pregnant women have inadvertently taken valsartan. If pregnancy is detected during therapy, Diovan should be discontinued as soon as possible. Lactation. Risk summary. It is not known whether valsartan is transferred into human milk. Since valsartan was transferred into the milk of lactating rats, it is not advisable to use Diovan in breastfeeding mothers. Infertility. There is no information on the effects of Diovan on human fertility. Studies in rats did not show any effects of valsartan on fertility. Instructions for oral use. Do not store above 30 degrees Celsius. Protect from moisture. Keep out of the reach and sight of children. For further information, please read the enclosed leaflet. To be sold on the prescription of a registered medical practitioner only. Manufacturer and buy online. Diovan tablets are manufactured by Novartis Pharma S.p.A. Italy. The sole agent of the medicine is Novartis Pharma Pakistan Limited. It is available online or can be purchased from any nearby pharmacy. A full box of Diovan 80 of 28 tablets is priced at approximately 2,365 rupees. Thanks for watching and supporting. Take your medicines as your doctor or pharmacist prescribes them. You can check its article at MedsArchive.com. Have you ever used this medication? Please share your experience in the comments. Which medicine should we cover next? Your suggestion could be our next video. MedsArchive 1.